Hi, my name is Bernard Jones. I'm a DMP student at Bradman University, and today I'm here to discuss an overview of innovational leadership as it pertains to my scholarly project. During this presentation on innovational leadership, I will discuss strengths and weaknesses as it pertains to my leadership styles. I will also discuss the developmental plan that I will use to um, launch my scholarly project. And lastly, I will discuss my leadership philosophy. My leadership philosophy is a combination of a health promotion as well as two leadership styles. My leadership strength includes my ability to think abstractly, also the ability for me to think outside of normal perimeters. Some actually refer this to as thinking outside of the box. One of my strengths also includes the ability for me to work well as a team member with my followers. And lastly, and I have this listed last, but I really think that this is one of my strongest leadership strengths, is the ability to gain trust from my followers. And I think that is very important as a leader. The followers have to be able to trust their leader. That makes for a very good working relationship. My leadership opportunities is that I wouldn't necessarily say it's a weakness. As the header says, it's a opportunity. Is that I have a bad habit on taking on multiple projects. I take on too many projects. I have too many irons in the fire. As you can give note to the illustration that I have here with the young lady at the desk and there's a piles of paperwork, this is what I have a tendency to do. I take on tons of opportunities to try to advance to what I call the next level, but I think it's most time for me is too much at one time. I often refer to as I'm like a candle burning at both ends. This is definitely one of my leadership opportunities. Other areas of opportunity for my leadership style is utilizing more resources. That's one thing that I can definitely do better, is to utilize more resources. With the amount of projects and tasks that I attempt to take on, if I can utilize more resources, this will help me to be more efficient. And when I'm talking about utilization of resources, I'm really referring to using more people to assist me, using more people to gather on my team. And once I gather more people on my team to help me with projects, I need to be more of a delegator, a task delegator. Now, once I delegate, I need to allow my team members to continue what I delegated to them, because I have a bad habit of once I delegate something to a team member, I often like to take it back from them because they're not doing it the way I want it done, or they're not turning it around more, um, they're not turning it around quick enough. So in this instance, what would be an opportunity for me, instead of taking this project or this task back from a team member, I need to assist them more, but also at the same time allow them to keep the task. Leadership utilization. I will use my leadership strengths to recruit school nurses to assist with my scholarly project. My scholarly project is on childhood obesity within the school age children population. And to launch this scholarly project, the setting will primarily be in the school system. And I will need a lot of help from the school nurses to gather data from students that meet the criteria to participate in my project. And their primary job would be to do height, weight, and waist circumference. And I will also introduce my leadership theory to motivate participants for the scholarly project. As mentioned previously, I included a health promotion model of Nola Pender, and I will kind of use the Nola Pender theory to motivate participants for the scholarly project, which includes making them aware of their health, making them aware of different type of food choices and what they can do to improve their health. The philosophy of the proposed leadership theory is the idea of including two leadership styles with a nurse leadership health model. For the purpose of this discussion, I would like to refer to my leadership style or my leadership theory as the Jones leadership theory. Using a leadership style such as laissez-faire and participative will help promote good ethics that will allow the leader to lead by example. Now, I'm a firm believer that a leader needs to lead by example. I have a tendency to try to work just as hard as my team members or work even harder than my team members because I want the team members to observe me working and see and let them know that I'm part of their I'm part of the team. And usually when a team member sees that I'm working hard, in turn they will work hard for me. Now, healthcare leaders as well as leaders outside of the healthcare arena should lead by example. Leaders will receive a positive feedback from subordinates when leading by example. In healthcare, leaders should adopt a health model theory to promote healthcare. Adopting the Nola Pender health theory will assist leaders in promoting health for better patient outcomes. Any philosophy of leadership in healthcare should adopt a theory that promotes health. Although in some healthcare arenas, healthcare administration is the primary focus, the primary focus should be promotion of health. Health promotions are the key ideology that helps reduce healthcare costs. As a healthcare leader, goals to accomplish should include reducing costs by delivering cost-effective healthcare. And I applied this to my project because the overall goal of my project is to promote health. I want to raise awareness of childhood obesity both to the child and the family, as well as their healthcare providers. In most cases, the healthcare providers in the school system, they are aware of the epidemic of childhood obesity. However, there's not a lot of emphasis put on health promotion as it relates to childhood obesity. And these are just a list of my references. Thank you so much for listening to my presentation.